So my next question is, how important do you think is fitness for an orthopedic surgeon?
My mentor, Professor Judet, used to, I remember very well, it was 20 years ago, he said me, once he said, orthopedic surgery is a sport, but a very demanding sport. So you have to, and this, my mentor was very fit, very, very fit. And he was working like nobody worked in France from 7 to 10 p.m. every day with a high volume of like a surgery and very difficult surgery. So I believe that fitness is important for surgery. And more you become old, like me, more you feel it. And you have to work a little bit to be in shape. Yeah. I mean, if you are fit, correctly fit, I'm not a crazy guy with fitness. Uh, well, the week of work are easier to to be completed. That's easier. You have to be fit, yeah, a little bit, I guess.
That's a very important message, Dr. Martin.
Uh,
So the next question is, you are in the design team of Evolutis for
yeah.
some implants. So how did you become a designer surgeon? So how did you enter the team of Evolutis?
Well, I entered a little bit by odd because I meet them. One important thing is that probably because I have high volume surgery for France. I know for France, so I'm doing like 80 reverse prosthesis a year, which is not statute, but that's important for 20 years. So that make a certain number. So experience is very important. Well, you have to be able or to wish to work in like I said, like a team with different kind of person, like engineers, uh, CEOs. We are talking also about the cost effectiveness because you can't imagine everything if it's not cost effective. Uh, and well, your patients because it's important and the wish to create something, even if it's a surgeon is creating a little piece of the prosthesis. He gives some advices and based on their experience. Finally, it's not like Dr. Gramont invented the reverse. Now in not this in our time, it's not like this. It's just improving some things. But Evolutis, I've introduced. It was before I came with them. I was a little bit linked. I'm not working only with. It's a small part of my work. But Evolutis invented the 135 NSA cut back in the 200 to 6, I guess, 206, something like this. So that's an interesting. I mean, they improved the reverse system for sure, which was before I came. No, I'm working with them. I'm working with them on we designed with other surgeons. That's a team experience. Stemless TSA, which is a good one. And now we're working now on the next generation of the unique Evolutis prosthesis, based on experience of other surgeons and the wish of the people who want to try it.
Okay, it is basically the experience and the volume of the surgeon to be a
Yeah,
part of
that's
the
possible.
training team.
Yeah, yeah.
Okay, okay. So, like, what is the innovation culture like in France for an orthopedic surgeon?
It's huge. Innovation. That's a good question. And it's well, first, for example, the first shoulder prosthesis have been done in France back in years of 1855, something like this. But more recently, the first THA have been done in France by Professor Gide, the father of my mentor, in 1947. The use of the anterior approach for hip surgery is from 1947 in France, in this department. The first ceramic use for THA also, it was in France back, I think, 1947. The first cementless hip prosthesis, Professor Judet also already, something like 1971. What's about the titanium? I think it was Sarah also in 1974, 5, 7. Gilles Valch, we talk about him. He's a great shoulder surgeon. he designed with his team the third generation TAC system with Tornia, modularity and rotation, retroversion, all you can imagine. And well, Caffarel, you can talk for spine, Cottrell du Bousset. Before him, it was like Harrington, Rhodes. He invented the pedicular screws back in 1985, something like this. And the reverse, well, and even I heard that the first arthroscopy has been done in Lyon, which is a city in France, and something in 1965, something like this, without a camera, just looking through the joints. Well, that's quite a big, many things. Thanks probably to the system, not too cheap, not too many, not too many normas at this time. No, it has changed. Now it's difficult. And high volume surgeon, not too expensive. So that's rather. So that's an important innovation for sure. And the Evolutis 135, it was the first one, and they say it was in France also.
So how is the current culture? So how are the neurosurgeons channeled into innovation?
How nowadays, you mean?
Yeah.
Well, thanks to what are the new challenge you mean for innovation? You mean?
Yes. Yes. Exactly. Yes.
In what, in orthopedic in general or in shoulder?
In orthopedics and in shoulder both.
That's a difficult question. I remember one of my postgraduate when I was in a resident. He said it was interesting. He said we are at the era of mechanical improvements. That means on the prosthesis, the implants. And he said the future might be biological. That means for shoulder, maybe for tendon. Well, I mean tendon in rather the cuff. Maybe biological implants to enhance the rate of healing or the thickness of the cuff. Like it's tried now. We have I tried many years ago the Conexa from, for example, from Tornier. Nowadays there is one from Smith and Nephew, Regenerative. That's part of maybe the future. I don't know. And we have done many improvements in mechanics. More very advanced now. Even the polyethylene is now it's enhanced polyethylene. No much wearing. The ceramic doesn't broke anymore, kind of. So the future may be biological. I don't read exactly the future, but more for the world, I will say, or India, for example. We talk a lot with surgeons, particularly the organization of the health system. That's important. And I was thinking about the conversion rates between the number of patients you see and the number of patients you put on OT. That's an organization problem worldwide. That's the access to the good treatment in a reasonable time. Surgeon told me that for some time in some part of India, the conversion rate is not so great. And maybe the system of France is not perfect, but still, every patient in France are supposed to have a GP, which is referring to specialists. So, and after the specialist is selecting the patient for surgery or not. So that's quite efficient. So logistic and biologic maybe are the two future main topics, probably.
Okay. So you have recently started a short-term shoulder and elbow fellowship with Indian fellows. So what inspired you to start this program? And
Well,
What is the duration of it that you expect?
Well, it was a little bit by odds because Evolutis sent me for many years surgeons to show them my practice with the reverse and also arthroscopic, and some of them, like Dr. Sham, he said, "Okay, you have to come to India." So I went to India to talk at Coimbatore and tried to talk because my English was quite poor at this time. I'm trying to improve that. And I had many requests to come to me. So I said, okay, let's try. The first one was Sojourn. We came very bravely and alone to France during 2 months, I guess, 2 to 3 months. And well, it's a custom thing for me. I told them because I don't exactly know what is the best duration. I know I like very much to share things with Indian surgeons because you're particularly nice people, hard workers, courageous. That's it. What can I do more? What can I say more? And so the duration is I have some from after surgeon. I have 6 or 7 fellows. The last one was left today from India. From 3 weeks to 3 months, the duration it was. I talked with my last fellow, Dr. Ronsi, yesterday about this subject. I said, oh, well, for him, well, I think 3 weeks is a little bit short. 3 months is okay. The best will be 6 weeks to 3 months, I guess. And I think it should be better if they came 2 by 2. Like, because surgeons was a bit, well, in France, one of the problems in France is that nobody speaks English, mainly in the streets, in the restaurants. So sharing thing, it should be a bit boring. Maybe, I don't know. Surgeon was the only fellow who came by himself alone, and we don't like that the people suffer from loneliness, because we're working like maybe 50 hours a week, but and sharing some experience with food, with visits sometime when possible, but okay. So now 2 by 2, 2 of the surgeons came at the same time. Surgeon, it was Fabian and Subin during 6 weeks, I guess. And now the latest fellows who came, they shared time. One came from let's say week 1 to week 12, and the other one it was overlapping. Overlapping is good because the experience the French experience can be easier for the next coming fellow. Overlapping fellowship I think it was quite practical also. Better for the but 2 by 2 is better, I guess. I mean, having 2 fellows at the same time, I think is a little bit better. How do you feel, Sujun, about this?
Yeah, I think, as you said, there are not many people who speak English, so it's very difficult to be alone in such a big place. So, as you said, I think it's good if you have a person who can understand what you're saying and you can
Mates,
understand what he's saying. Yeah,
mates, fellow mates, fellowship mate, we can call that. That's a good, I think, better, nicer.
Yeah, co-fellowship is always wonderful because you can learn from the fellows also. So our next question is, like, what is the surgical exposure they're getting during this fellowship? Like, it's only open or arthroscopic or trauma or only sports-related cases, or how variety of cases are being exposed during this fellowship?
Well, so it's only upper limb surgery, 99% of elective surgery, because trauma, sometimes the trauma is coming referred by the GP of my friend, so do something. So basically, I'm doing my week are very easy. I'm doing some carpal tunnel releases, ulnar nerve transposition, Dupuytren's disease, epicondylitis, something 10 to 12 shoulders a week. That will be 2 reverse, or maybe 1 TSA sometime, 1 latarjet or 2, and the rest will be cuffs and some acromioplasty, some tenodesis of the biceps. Arthroscopic. So everything is arthroscopic except latarjet and the prosthesis.
So, are fellows expected to scrub for the surgeries, or do they assist only or just stand and observe? How do you expect them to be?
No, the fellows are always scrubbing with me. That's important to be close to the thing, except it would be a nonsense to let the fellow just looking 2 or 3 meters below it. That would be nonsense. If I was, I'm a private, so I can help them to do things, except some arthroscopic knots sometimes. We do that because it's private. That's the limit of my. If I was like my mentor in a hospital, I would help the fellows to do things directly, helping with the hands. That's the only limit. So everybody's scrubbing all the time for sure. With the limits of private, so I have to do the job by myself. Except as I told you, some knots. Sometimes we do some arthroscopic knots on the cuff. So yeah, that's it.
Do you expect certain level of prior experience for the fellows to come there? Should they be already trained in shoulder arthroscopy just to pick up, or can they be a beginner? What do you expect a fellow to have previous training? What are the requirements and ideal profile for the applicants?
It probably depends on the duration of the fellowship. If you came for 3 weeks, like Dr. Ronsi came last week, he's an advanced shoulder surgeon already. So 3 weeks, maybe it was enough. If it's a resident, it would need 1 year. So for me, the best duration, because just for that you are far from home, so that would be 6 weeks to 3 months. So it should be better if the fellows are maybe postgraduate or during their post-graduation. After residency, it would be better for sure. And having a little experience of open surgery is not so difficult, we'll say, but not to be lost in a shoulder or arthroscopic shoulder, maybe a little bit better I've been exposed to, at least arthroscopy, even knee arthroscopy, to be able to know what triangulation is, or thing like this, So probably postgraduate is the best, or during post-graduation, why not? If possible, with the courses.
So, has there been a situation where an Indian fellow who has trained under you is looking for long-term opportunities in France? What are the possibilities, and what advice would you give for such fellows?
First of all, France need new, surgeons and nurses, medical care. There is a lack of medical care workforce in France, like in all over Europe. It has been worsened since the COVID time a lot. I don't know how is it in India, but in France it's a big problem. Many people don't have, for example, a GP, but GPs are required normally. Everybody should have. So, for example, and I saw that there's a license problem because Indian license is not working in France, I guess. So it could be difficult, except if the fellow come back to the public system and taking the exam from the not very beginning, and probably from the beginning of residency. Private surgeons can't have a role in that because it's a hospital. It's the national scholarship system is difficult. It's different from ours. But I've discovered recently, talking with the fellows, that there are an organization which is quite specialized in sending, I think, especially Kerala doctors and nurses to Germany, which is funny for us because I don't know why in Germany, because they're lacking, I think, 150,000 nurses. Like, I don't know how many doctors with the aging problem they got with their population, particularly in Germany. So if that's possible, as Germany is part of Europe, somebody who is allowed to work in Germany should be allowed to work in France. I don't know. That's something we can dig on and trying to understand more. But definitely it would be nice if some Indian surgeon or nurses could come to France. I would love that.
Okay, now we are entering rapid fire questions. So you can answer the questions as short as possible, probably in one sentence.
Uh-huh.
So the first one,
Okay.
if you have to perform only one surgery for the rest of your life, what would it be?
As getting older, I think it will rotator cuff, arthroscopic rotator cuff surgery. Not too dangerous, funny to do, not too tiring because I'm older. I mean, not very well. Yeah, you had to do that the next 40 years, I don't say. Rotator cuff would be good. Yeah.
So one surgical instrument you can't live without. Which will that
Uh,
be?
it's my favorite mental one. It was the osteotome, 15 millimeters long like this, sharp 40 degrees, 25 degrees with a hammer. That's the best.
Which music do you prefer to play in your OR?
I don't, as I'm talking a lot with my fellows, I don't have a lot of time. It's difficult to, so not too much music.
So what's one thing you tell your
What's
residents or a fellow before a tough surgery?
I say it would be a cuff surgery, stay focused. We'll have a hard time maybe. That's it.
one myth about shoulder surgery? That
Yeah, for me. Well, the role of the long head of the biceps. I am a biceps killer, like Gilles Valche was.
Okay, the last one. So if you weren't a surgeon, what would you be doing? Like, will you be coaching rugby or designing tech? What would be your decision if you're not a surgeon?
I would be an architect. That the second work I always wanted to do before within medicine. But I mean, rugby sports coach would be very interesting also, and designing tech also. So, but I think it would be architecture. Yeah.
France has missed you as an architect.
Oh yeah, maybe. France is beautiful. You have to visit it.
Definitely. So that's
So
that's all we have asked
I want to
questions. Yeah, sure.
I want to add two questions. Actually, we forgot to introduce them into the questionnaire. So I know that you are a good musician. You play electric guitar. So can
Yes, sure.
you tell about that? How you meet up your band and where you play? Anything about that?
Well, as you tell, I'm playing the guitar and some instruments, but I'm playing in a group with a team, and actually the team, the group, the band is all nurses and doctors from my OT. So that's part of the same thing, linking people, working together, doing things together.